what motivated me to enroll in this program was just the mission. Being from the community, being from Hunts Point, growing up here, Urban Health Plan was always my community health center. So as soon as Davin had mentioned the program to me and sort of its mission and what it stands for, I knew like it was the right fit for me, because I wanted to, become a PA and then transition into working and giving back to my community.
The founder and how he himself is from a familiar background that I grew up in, being like a first-generation student, and just seeing the patient care that was provided at Urban through even just the social media really highlighted my own mission to work in a CHC myself and become a provider like I see here at Urban.
One thing that I learned from the clinicians and preceptors here, I know that Urban Health Plan has a in-home service. One of my experiences was that I was an EMT. So I'm going to people's homes, providing care for them, and then transporting them to the hospital. And in internal medicine, on Wednesdays, we would go to the patients' houses, provide those care, do their vitals. I think that was one of the most memorable experiences here.
I did learn teamwork and how it's very significant in healthcare. So I did observe a lot of physicians. They don't work by themselves. They always work in collaboration with others, like a social worker or a nurse or medical assistant. They all work together to help the patients.
I think the biggest thing that I've learned is how to just kind of take each patient as a new experience and not to get overwhelmed, and that having patience and taking time to really understand the condition, understand what you're doing and how to treat the condition at hand is really important. So I think what I've learned the most is patience and how to trust in yourself and trust the community around you to ask questions.
I would like to thank all the preceptors. They were all so nice to me and they were so helpful. I got to learn a lot from each one of them. A special thank you for Davin and Brenda. They were so hard with us, and they made our experience a lot more easier.
Also, I'd like to thank Urban Health Care. It's just the fact that we get to have this opportunity. Not everyone gets to have this opportunity, and it's just a blessing.
What I would tell somebody, if you're considered enrolling into the ATSU program and doing your rotations at Urban Health Plan, is you should 100% do it. It's a very unique program in that you're leaving an impact. And I think that's really important when you are going into becoming a provider.
I mean, I had an exceptional clinical year experience. I was very fortunate to be able to be a hometown scholar and sort of just come back here, and I'm just excited to continue that journey and continue growing as an individual, as a person, and just continue to meet people and be able to just provide those services that our community deserves.